Today.
I'm good. How are you?
I'm hanging there. Ready for your shift?
Yes.
Okay. We got a 74-year-old female here, Mrs. Laura Johnson. Um, she has history of hypertension, coronary artery disease, and COPD. She's here for treatment for stage 3 breast cancer.
What is stage 3 breast cancer?
Okay, stage 3 breast cancer is when the cancer has spread beyond the original start through the surrounding lymph nodes. It's divided into A, B, C, depending on the type and the size. So in stage 3A, the cancer might not be in the original site, but it's present in at least 9 of the surrounding lymph nodes. Or the cancer might be the size of a 5 centimeter lemon, while 4 lymph nodes total could be affected with the presence of the cancer. Or it might be bigger than a 5 centimeter lemon with at least 3 of the surrounding lymph nodes affected by the cancer cells. So this patient seems to be very restless and scared. She claims that she has not been in to no hospital for the past admitted to an hospital for the past 35 years since ever she had gave birth to her son. Okay, we're gonna be using chemo, oral and IV. So chemotherapy is a treatment that contributes to reducing the size of the tumor to make it more to make surgery more successful for removal. Sometimes it's combined with hormonal treatment and targeted therapy. It's in this case going to be designed to get rid, destroy the cancer cells altogether. Okay, so it's got many side effects. Need to be aware of this patient's history of allergic reactions and drug use, whether it's illegal or over the counter, and alcohol abuse, and history of bleeding. And in this case, we need to be really careful with uh, the respiration distress because this patient already has COPD. We're gonna be monitor after the chemotherapy for the oxygen saturation level, especially. So we can expect side effects such as neuro side effects, which is numbling and uh, numbness and tingling in the extremities, and vision disturbedness, balance issues. Okay, and as far as hemo issues, the person is definitely going to have a reduction in the blood cells, bleeding issues caused by low platelets, uh, risk of infection, major risk of infection caused by the reduction of the white blood cells, and the red blood cells, risk of poor oxygenation, which might cause a shutdown in the organ tissues. Uh, so we gotta monitor for all those. And as far as well, reproduction, we know that those chemo drugs destroy the ovaries in young females, especially. They might not be able to get pregnant tomorrow, and some of them might even develop signs of menopause. Okay, hot flashes and stuff like that. Okay, there's a lot of issues with pain. The patient may feel weak. The patient has poor appetite. We already said GI. Okay, so GI, emo, and reproduction, neuro. Those are major side effects to be watch out for. So the vitals, they were taken a little earlier. Blood pressure was 190 over 89. Temperature was 96.8. Um, Pulses, epical pulse was taken at 90, and bilateral pedal pulses were 94. They were very weak, but they're there, and there's no swelling in the calves, so that's good. We don't know that worry so much about heart issues. And what else? The respiration rate was at 19. Okay, like I said, she was apprehensive, so that's expected. And I did say blood pressure, temperature, respiration, pulse. Uh, okay, her SPO level was 94, so she's all stable right there with oxygen level. Okay, she also uses a can for ambulation. So we gotta be very careful with that. Make sure the call bell is RH, and she can use one person assist to go to the bathroom, and no falling, absolutely no falling. She's at very high risk, so even in the bathroom, she gotta be monitored constantly. Make sure the bed is lowered all the way to the floor, and her bony prominence is well padded. They are very fragile. Her skin is very fragile, and we don't want no bruises or no type of skin issues while she's here. Okay, so I think that's basically it. If you don't have any questions for me, I hope you have a good shift.
Okay, thank you.
All right.